Dear friends and colleagues, I'm Dr. Francesco Mangano and I welcome you back to the Mangano Digital Academy and to the Essentials of Digital Dentistry. In this series of videos and lectures, we have talked about different aspects of planning with digital dentistry, particularly in implant prosthodontics, but also in prosthodontics in general. And in this lecture, I will talk about an interesting opportunity that we have now for prosto, also for gnatology, and potentially also for the orthodontics. We will talk about the digital bite splint. It's an interesting topic for me because I've studied gnatology for many years and I'm really interested in that. I'm interested in temporomandibular disorders, but in general, now the digital dentistry gives us more possibilities to treat patients in a smooth, very direct and straightforward way, and it's really nice to do it. And I will show you some case in order to understand how we work, in order to share our knowledge and the way we work with you. Once again, digital dentistry is based on 4 steps, and these steps are the scan, data acquisition from the real to the virtual. We have several devices like combined computer tomography, intraoral, desktop and face scanners, and digital condylography to gather data, 3-dimensional data from our patient. These data are then transferred to software. We have surgical software, prosthetic software, and we also have software for orthodontics. With this software, we make our plans, our evaluations, we perform our diagnosis, and most of the time we also elaborate our treatment plan. And we design things. We design, for example, restoration, crown, bridges. We design surgical template. We design bites, for example, for orthodontic treatments or other things. And then we can produce and make these devices and going again from virtual to real, using milling units, using printer, using technique like selective laser sintering and selective laser melting. And we can then apply these devices, these surgical templates, clinically. For example, for surgery, these bites, we will talk about the bite splints, for example, maintaining the results after orthodontic treatment to help the patient suffering from temporomandibular disorder or centric relation bite. We have several options. Also, of course, we can mill our prosthetic restoration. This is digital dentistry, more or less. And let's go to the bite splint in particular and how to design a bite splint in a modern way, because we have several options, of course, but today we have also the material and the printer to print bite splint directly, and they work very well. So how we work, how we proceed in this case, we take an intraoral scan of our patient, and this is the first appointment. Then in the second appointment, we can immediately deliver our bite splint. The planning is made entirely in computer-assisted design software, and I have to say that we have also this option today during the first appointment, not only scanning the patient with an intraoral scan, but also using a digital condylography, a machine like Mojo, very powerful, to gather data of the movement of the mandible in the space, individual movements, in order to gather data individually, of course, of that patient, those movements customized in order to replicate this movement in the virtual articulator with the export of this movement exactly inside the computer-assisted design software. And with Mojo, it's possible. I will show you something later. But the point is that this information, intraoral scan plus digital condylography, all together, they are sent to the dental technician. The dental technician make a plan, design his bite splint, and then the only thing that we need to do is to export the standard tessellation language of this bite splint in order to print the model, to print the bite splint, to check the bite splint on the model, and then to apply the bite splint clinically in a second appointment. So more or less the first appointment can take 30 minutes to 1 hour if we use the Mojo as well, but it's much better because we have individual information about the temporomandibular joints and the movement of the mandible of the patient. It's very good to functionalize the bite at best. Otherwise, if we want to act like medium. In medium terms, we can avoid to use the digital condylogram, but we need the intraoral scan. And this is how it works in a very simple case. A very accurate scan is given by the CS3700. I always save my scans in a high resolution. I prefer to do it, but sometimes for ortho and for these purposes, like for a bite splint, you can also save them in medium resolution. 200,000 triangle per model is sufficient. You don't need to have 400,000, but why not? Because we have this option. No issue at all. We need to capture the model in maximum intercuspation, so please be careful when you capture the bite, because you need to transfer this information to the dental technician. Check that the patient is really closing well, check that the patient is not moving exactly in this moment, check that the intensity of the maximum intercuspation is the correct one. You can check it intraorally, you can capture 2 or 3 bites per side in order to be sure that everything has been made correctly. Usually, technically, there are some issues when you scan, for example, on the right side. There must be some problem on the left side, because the patient tends to bite more and stronger when the scanner is on the side where the scanner is. So please check that the patient closes it perfectly in maximum intercuspation in symmetry. And then you can eventually register more information using a machine like Mojo for the individual registration of the jaw movements. And these jaw movements are exocad compatible, so you can export this movement inside the exocad. So the dental technician can plan in a virtual dental articulator, having all the setting of the articulator itself and having all the movements of the mandible according to the real movement of the patient. It's really the 4th dimension in prosthesis, in prosthodontics, in gnatology, in orthodontics. It's really a very cool machine, and I suggest this machine because it's really fantastic. And then in this very simple case, the dental technician doesn't want to do nothing special. He wants to design a bite for relaxing the muscle of the masticatory system and the jaw. And basically, a vertical dimension of occlusion is modified according to the plan for creating the space for the bite. And this bite splint is designed accordingly using the operator of the exocad software, the computer-assisted design software for the prosto, in this case, valuable tool also for designing the bite splint. This is the design of the bite splint. And this is the bite splint in the exocad dental CAD virtual articulator with the models. So the antagonist and the master model. Of course, we need to capture also the antagonist, otherwise it's not possible to properly design a bite splint. And here the bite splint standard tessellation language files from different perspectives. It's very important to control the quality of these files before to go to the printing machine, to the 3D printer. In this case, I'm using a software, Autodesk, developed particularly by W2P for Voco, because I'm using this printer, exactly the Solflex 350 by Voco, in order to print all my bite splints, because it's very easy to print these bite splints using this machine, and the material that they have are fantastic because they are reliable, mechanically resistant, and they are also very comfortable, and they change in phase during after they have been printed and after the post-curing process. So it's really interesting. You can print them, so it's very important to have, of course, the adequate support, and also to prepare a base adequate to print the model. Then you have to print the bites, and also then you have to print the model. The model can be printed with in resin with appropriate material, also by the Voco, and then you can stabilize the model with a little bit of stone, or as we used in the past. And these are the bite splint printed by the Solflex 350 by Voco. The material is really very interesting because it is reliable, it is mechanically resistant, and we can work with very thin layer. And I think it's the very beginning of a path that will bring us to print probably the aligner in a very reasonable time frame. But at the moment, for the bite splint, it's perfect. This is the printing plate, in this case 2 identical copies, with printed with the V-print Splint Comfort material that is absolutely the material for the case. A job like this can last for can take approximately for the printing 3 to 4 hours, but it's very accurate what it comes from. And then we can of course see the two identical copies of the bite. We need of course they need to undergo a post process. They need to be cleaned by the using alcohol, and they need to be cured in a special machine given by the Voco. We use 2000 lumen in this case. The post-processing is quite fast. In 2 minutes everything is ready, and then we can check everything in the adaptation of the bite splints on the model 3D printed. This is the bite splint after curing. It's very interesting because the material is hardened very well, but at the same time it's very comfortable, and we can work also with thin layer. It's not too thick, it's not too, difficult to wear for the patient. It's very comfortable, and it's a good advancement in the term of material by Voco in particular. And as we can see, the adaptation on the 3D printed model is almost perfect. We don't have to do too much. We can the dental technician can a little bit modify and polish and smooth it if needed. Then the dental technician wanted to recheck everything in Articulator using to compare a little bit the results obtained when implanted with the virtual articulator with a real articulator for a final dynamic check of the occlusion and with the jaw movements, and everything worked well. More or less like the one planned, and we could deliver the bite for the clinical application, and everything worked very well because the material is comfortable, thin but resistant, and the possibility to print directly the bite allow us to skip some steps that were before unavoidable, like the one of printing the model and then creating the bite in a very conventional way on the model. That is also quite difficult because of the material, and the best things is to proceed. So it's very reliable, it's very accurate, it's very long lasting, because we have some patients with this bite for months and they don't have any issue from mechanical point of view, and the results clinically are very very nice, because for example, patient with temporomandibular jaw disorder, they can be treated accordingly with this pre-treatment, and it's very comfortable, and it can allow to reduce the pain of the temporomandibular joints, to reduce the discomfort in the muscular and in the masticatory system, and help also to avoid destruction of the tooth substance in some cases. So it's a really nice application, and I want to thank you very much for your kind attention. Now it's really possible to design in computer-assisted design software and to print excellent bite splints for many purposes, orthodontic purposes, purposes for the temporomandibular joint treatments, for gnatology, and it's a very fascinating field that is going under development very fast, with an improvement of the material that have been incredible in the last months, and I think we will see also more improvement in the next months and in the future. Thank you very much for your attention.